So the Ancestral Sinews is a name kind of given to our core muscles that hold our upright posture. And in the process of holding our upright posture, they are also, literally connecting us with above and below. So they kind of connect us to the ground, they connect us to the sky. So we have like earth and heaven. And then once we start kind of getting into these connecting points, we're getting into larger fields of consciousness. And then we also have, at our core, we're kind of getting into our genetics, what we call the marrow in Chinese medicine. So we're kind of going inward towards the genetic tendencies, and then we're also going outward towards the sort of the multidimensional aspect of connecting with consciousness.
That really helps a later question I was going to ask about why we are moving past a structural issue when we talk about the sinews and more into maybe a spiritual or a soul issue. That's a fascinating connection. Now, you described the iliopsoas in your course description as the soil of the soul, and then you go and say that the diaphragm is known as the spirit muscle. I'm really curious about those two terms. What does that mean when we're talking in a clinical sense?
Right. Those are terms that Taoism has ascribed to those two muscles. So we have the psoas, which is connecting the legs to the pelvis and to the spine, and then we have the diaphragm, which we use to breathe, right? So a lot of these ancestral sinews, so they're tangible. They're the sinews. The spirit we think of as intangible. So we're kind of using the tangible to access, the intangible, hence the ancestry. And they tend to be framed by the response to stress and survival. So the autonomic nervous system with the sympathetic fight or flight and the parasympathetic rest and relax are kind of how the ancestral sinews are governed. So like we have the soleus and the calves, and they break our root and they make us want to run. And then we have the psoas, can make us kind of fold into a fetal position and freeze to protect our organs, or it can make us prepare to look big or to run. And then we have the diaphragm that's going to do all sorts of things, changing our breath to conserve our resources or get us to do things. So they're at this sort of core response to survival. And that's another aspect that they have with ancestry, is that we probably are handed down hereditarily all the responses and traumatic responses that were unresolved in the ancestors before us, and not in just like a psychological sense, but how is that written into the musculature that kind of governs our structure. So the spirit muscle of the diaphragm is one of the first things that we can control with our breath. So all these things are unconscious and automatic. So the spirit muscle, we get to be able to combine our consciousness and enter into the autonomic by taking responsibility for our breath. But the psoas is the soil of the soul, and that's just a little harder to dig into. You kind of have to get more stretching, more movement, and any sort of gains or awareness that we have at that level is kind of like digging into the darkness. This is like the lower body, the pelvis, the reproductive energy, the genetics, the shadow. And so by working in those areas, we start to honor some of the lessons of our ancestry.
I'm curious, clinically, what type of patient would need an ancestral sinew treatment? When would you refer to the sinews in your treatment plan?
Well, a lot of times with the ancestral sinews, we are evaluating their health in general. Like acupuncturists always think about is the diaphragm blocking the upper jaw or the lower jaw. If the psoas is tight, it's going to make back pain more likely. And the Ming Men is where the diaphragm and the psoas come together. So we're thinking about them already, even if we're not thinking about them directly. When we start getting into the yuan qi, the 8 extraordinary vessels, divergent channels, now we're kind of in the terrain. The ancestral sinews are talking about the same level. So we use them a lot as an adjunct to an 8 extraordinary vessel treatment or an adjunct to a divergent treatment, where we'll gua sha the SCMs because we want to release this area. We'll gua sha some of the psoas area or below the diaphragm, trying to stimulate that so that it allow movement for our acupuncture treatment. We also, with the sinews, a lot of times it's manual therapy. So we do have these needling techniques that can be superficial or they can be quite deep, but we often use hands-on techniques when it comes to the sinews. So we'll be doing some sinew releases for Du4, and then we'll be doing some needling technique for the diaphragm, and we'll see where we go from there. But I look forward to demonstrating some of those techniques in class.
Excellent.